Hello, my name is Carol Somerville Roberts, and I would like to explain to you our amalgam removal protocol that we follow here at Evolve Dentistry. First of all, a little bit about me. I've been carrying out amalgam removal using this technique for over 20 years. I'm also a member of the International Academy of Oral Medicine and Toxicology, and I aim to follow their protocol. I always will base removal on individual needs, and we will always treat decayed, cracked or painful teeth first. I will only remove up to 3, but not necessarily 3 fillings at one appointment, and recommend a minimum of 2 weeks in between each appointment to allow for full recovery. It can be longer than that, but never less. So what we would do initially, we would need to carry out an assessment and take any necessary x-rays. We need to do this assessment to ensure that amalgam removal is the right thing for you. If you've already got some x-rays from your current dentist that had been taken within the last 12 months, we're very happy to use those if you can get hold of them. And once we have done a full assessment, I will go through the protocol and then go through a treatment plan with you. Every single person has an individual treatment plan depending on what is right for them. So in order to do some initial preparation before your appointment, we recommend that you take chlorella, vitamin C and omega-3. There are other things that you can take, and if people are working with their own therapist or a nutritionist, they may have a protocol that they will be following. During the actual removal, on the day of removal, we would make sure that you're comfortable. So usually we use local anaesthetic. I will discuss with you which local anaesthetic is the right one for you. Once we've made you numb, we give you activated charcoal. Now we like to do this after the local anaesthetic because most people like to rinse their mouths out after they've been made numb, and we would like the activated charcoal to be coating your mouth. I then will apply latex-free rubber dam. The reason we use latex-free rubber dam is we aim to reduce any rubber within the practice. Plus, it has been shown that latex-free rubber dam reduces the mercury vapor transfer. And we will also then provide a separate supply of oxygen for you to breathe during the actual removal. The removal technique involves using 2 types of high volume suction, one that is sitting inside your mouth and one that sits just outside near your face to gather any particles. We use a particular burr called a tungsten carbide burr. This cuts the filling into chunks rather than grinds it into a slurry, because the removal of amalgam or the removal of the filling will release the mercury. Once everything has been removed from your tooth, I then sandblast the actual cavity to ensure that any tiny particles are removed. We ensure that the products we use are as sort of biocompatible as we can. We either will restore in porcelain if they're large amalgam fillings, or we will use a product called Admira Fusion. Following the removal, I would then recommend that you take homeopathic amalgam remedy twice a day for 5 days, which we will provide for you, that you have a minimum of 2 weeks between appointments, as I mentioned, and you continue with the supplement for a further 2 weeks. There are many times people ask questions, and we aim to answer any questions you have at your consultation, but I do not test for which fillings are leaking, because all amalgam fillings are releasing a very low level of mercury at all times. So if you wish to have no mercury within your system, you need to have all the fillings removed. Unfortunately, I cannot guarantee any change or improvement in your health at all. It is obviously undertaken at your own risk, and any tooth that we do treat, similar to any tooth that you would need to have treated for a routine filling, crown, etc., there is a risk that the nerve becomes inflamed and you may then require further treatment on that tooth. Some people do also get an exacerbation of their symptoms, which is why we will tailor each treatment plan to each individual and aim to work at your pace. If you do have any other questions, or you'd like to know more, or would like to book in for a consultation, do give the team here at Evolve a call and we will be able to look after you.